I guess that's our cue. Welcome everyone to the snowy February edition of Johns Hopkins Informatics Grand Rounds, where we bring the best and really cutting edge researchers and thinkers in informatics. And I'm very happy today to welcome my colleague Dr. Paul Heider from the Medical University of South Carolina. So Dr. Heider is an assistant professor in the Biomedical Informatics Center in the Department of Public Health Sciences and at MUSC. Paul serves as the head of the NLP core for researchers at MUSC who want to use natural language processing to extract structured data from unstructured sources like clinical notes, which is a topic near and dear to my heart. Paul has a background in computational linguistics and use of large-scale corpora for understanding the interplay between semantic representations and syntax. He's built and designed NLP systems for startups and multinational organizations, looking at traditional media documents and social media as well. Really exciting work. And Paul received his PhD from the linguistics department at the State University of New York in Buffalo, and his bachelor's from Grinnell College. So please join me in welcoming Dr. Paul Heider. And Paul, take it away.
So thanks for the intro, Nick. As Nick said, I'm Paul Heider from the Medical University of South Carolina. I don't have any relevant financial disclosures to talk about, but I do come from a privileged context that is still going to impact the natural skew of my work and the types of questions I'm asking and the types of answers that I'm going to talk about. Namely, I'm early career, I'm white, cisgender male, I have a US citizenship, I'm in a heterosexual relationship, I'm trained as a computer scientist and a linguist, I'm employed at a large teaching hospital. I'm expected to publish. I'm expected to get R01 equivalent grants, right? So that's all gonna frame what we're talking about and why we're talking about it. For the folks who are doing CME, you got some objectives here to think through. See if you can check those off. So how's the talk gonna go? Well, I'm gonna open up with one of our guiding metaphors here, model invariance, why it's cool, how we can use it, specifically how things like behavioral testing can be used to probe for model invariance, to help us understand our black box models better, right? So those black box models being the ones that we don't necessarily know what's going on behind the scenes under the hood. I'll do that talking about de-identification systems and how we can use behavioral testing to better understand performance of de-identification systems beyond just that single performance measure, F1, AUC, whatever that is. And then I'm going to talk about valence language, that's showing up in notes, and again, how we can use behavioral testing to probe how and what we're doing with valence language and how valence language impacts the models we're building. Then I'll do a little wrap up that's a little bit talking about behavioral testing and some of the generalizations and interesting tidbits there, and then a little bit about de-identification and valence language as well, just in case you only care about one of those two topics, and that's why you're here. All right, so as Nick mentioned, I got my PhD at University of Buffalo and did a cognitive science program there where we spent a lot of time talking about brains and how brains work and how brains don't work, right? And one of the really cool things that our brains do is something called image invariance, right? So when we're trying to identify objects in the world, things like cats on the internet, we do a pretty good job of doing that, even if that object is a different size or it's been rotated a little bit. And however we've learned to do that, it works out, right? And it's generally so good that sometimes there are these optical illusions that trick us, right? They go a little bit over the edge. And then it's maybe a bug, but it's only a bug and a problem if it's persistent and systematic, right? So sometimes these sorts of optical illusions are fine if they're randomly distributed, but if they're tactically deployed, if they're systematic, then they become a problem. And that's what we have to worry about for our models as well, right? So when we have these bugs, these edge cases, how do we know we should care about it? How should we know that we want to worry about it, right? And behavioral testing is one of those tools that we can use to look for these types of issues, these bugs, to test if our models are invariant to the things that we worry about and the things that are fine and they're okay to ignore for now. Um, all right. I want to also be really clear that behavioral testing is not the only tool in the tool chest to do this, not by any means, right? A vast oversimplification of Obermeyer and colleagues' work is that you could do something, you can use things like disaggregated analysis to probe the models that we have, the results that we have for these non-random, very regular systematized differences in the models we're working on, right? And we don't have to know how the models work, but we can still do it, right? Now, in my own work, in a project where we've been looking at Alzheimer's disease and related dementias, we also found a similar sort of, we were able to use disaggregated analysis to come to interesting similar sorts of results, right? So we had, for instance, this ICD model that's the standard of care right now, trying to phenotype patients for ADRD, and compared that to a random forest model that we developed. And the ICD model was beating the random forest. So generally we'd think, great, we want to choose the ICD model over the random forest. It's a better choice, clearly, right? And then when you do this breakdown looking by gender at how good the models perform on different types of patients, we found for the random forest, while there was this difference between male and female patients, it wasn't a big problem because it wasn't systematic enough to be statistically significant. In contrast, when we looked at the ICD model, we found statistically significant differences between the male and female patients, right? That gap was big enough and reliable enough to be problematic. So on average, maybe you want the ICD model, unless you happen to be a male patient, right? Then you want the random forest model because it's going to do better for you, right? So these are the sorts of things that we can use disaggregated analysis to dig into, right? And they can help us find systematic problems within our bigger models without necessarily knowing what's going on behind the scenes. Um, uh, so it's a good tool, but it's not the one that we're going to be using today. The other point of this that I want to talk about, how we can use this sort of disaggregated analysis to help us understand what's going on, that will tie into the behavioral testing as well, is you can look at the colleagues in the model reporting world, like Margaret Mitchell and her colleagues, where they've talked about also doing disaggregated analysis within model cards. And one of the things that you want to think of there is, well, let's identify the groups where performance is worst, right? Where we have the biggest gap between group A and group B, right? And by being able to identify those groups, it's not just about identifying the groups where performance is worse. It's about then being able to address those performance problems, right? So if we don't know about those performance gaps, we can't address those problems. The reason why this part is really useful and striking to think about is that once you've identified these groups, sometimes working on improving that the performance for those worst performing groups can actually help improve the overall model performance, right? Because there's some sort of gap, some sort of generalization you've missed that addresses the sorts of patients represented by those groups. Now, this is where it gets really tough and why it's really important to think about. In that same paper, Mitchell and colleagues talk about another project where instead of doing text processing, they're doing image processing for smile recognition. And the reason why this is important is the groups are completely different, right? The groups that you have to choose to analyze, the natural joins on which you are seeing problems is influenced by the medium and the nature of the medium and what's going into that medium, right? So you can't just use the same categories for every project every time. You need to think about the general framework about what are the risk groups, what are the natural biases that are going to show up. And then you can do the analysis, then you can do the behavioral testing to really dig into those categories themselves. Now, it may be that you don't really care about algorithmic bias, or you somehow have a completely homogeneous population. That's fine if that's true. Um, but then I would argue, as would Sogard and colleagues in their 2014 paper, that there are additional things that you have to worry about Additional factors that are natural to the actual medium you're working with that matter, things like sentence length, right? Um, and other structural components that are core to whatever medium you're working with, either text or imaging or whatever. And in that case, you need to do a similar sort of disaggregated analysis or a similar sort of behavioral testing approach to probe how things like sentence length cause problems, bulleted list versus prose list cause problems, right? Okay, so, um, that's all kind of giving you some general background on here are some cool tools, here are some problems we can use to highlight with those tools and why we would maybe want to pursue them. What does that mean as far as the types of questions I ask? Well, I do natural language processing, right? So I care about text. If you happen to care more about machine learning and AI, that's fine. ML and AI are two tools that you use to solve NLP problems. Um, so it's all the same thing, right? It's all going to fit within your problem case as well. So the questions that I want to ask are our models invariant to biases natural to the medium, right? So are our NLP models invariant or impacted by these substrate-based biases, these language-based biases? To ask that question and to then answer the question, you have to think about, well, where are these biases coming up? How are these skews coming up? Where are the problem joins within our data, right? And I tend to think about it to help me frame the problem in an efficient way is that there are two types of biases that are going to be showing up that will impact the work. On the one hand, when you're doing tasks like de-identification, and the linguistic bias is inherent in the concept you're actually trying to identify, right? So names, for instance, bear an enormous amount of cultural baggage, right? Cultural weight is put in those names, and you're trying to identify the names themselves, right? So that is actually the source of the bias, but it's also what you're trying to identify. So you're looking for invariance and sensitivity to the actual target. Are you worse at identifying certain types of targets, right? There's the other option. Um, uh, when you're trying to do something like, say, document level phenotyping, like that ADRD case I talked about before, where you have the entire document. It's not that there's one particular word you're focused on, but they're potential squirrel type words that I think of in my mind, distractor words, right? That skew the model, that significantly alter the model's output, and usually in the negative sense, adjust what it's looking for, right? And that's where we're going to use an example of valence language to talk about. That other example, these distractor terms that are also causing problems, but are also core in language and language variation. Um, to help frame where behavioral testing is coming from, as I said, I'm a linguist, right? So about 90 years ago or so, linguists like me and anthropologists were trying to figure out how sound systems worked, right? And even then, before the IRB, you weren't allowed to exactly crack open a head and poke the brain to see if they were understanding the sounds the way that you thought they were, right? That just didn't work, right? So the brain is this big black box we're trying to probe. And Swadesh and colleagues and other linguists were like, well, how can we indirectly probe that, right? So they came up with these minimal pair lists, what are now called Swadesh lists, when you're collecting them for language documentation, where you were trying to find words that differed in only one minimal bit, right? So the difference between pin and pen, right? In my dialect, I don't distinguish between those, right? I have a pin-pen merger. They're the same word. Jim, 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 Mary, Mary, Mary. Those are all the same word to me. My wife's dialect, those are different words, right? And I am, you can think about it that my language model is invariant to the distinction between pen and pen, which lots of English speakers can make, and I can produce, but I don't really receive very well, right? My language model doesn't distinguish between those, whereas her model is variant, right? It is sensitive to those differences. And that's what we're looking for. And that's what Swadesh and colleagues were trying to figure out. And we're still trying to figure out as linguists. Um, when are these differences, these minimal differences, significant enough to affect your final categorical output, right? Your label, your model, whatever you're trying to do with NLP. Okay. Um, For those who prefer pictures, we can also frame it in that sort of stance, right? So you can think about your standard evaluation pipeline in current modern natural language processing, right? So we have some sort of test set of documents, and we take that test set of documents and we pass it to our model, and we get some sort of output, right? And that output, a label, a percentage, whatever, right? That's what we're trying to evaluate. That's what we're looking for on the far end. Um, so what is Swadesh doing? Well, uh, what Swadesh is saying is, well, we're taking this test set, P vowel in, and we're altering it just a little bit. Just how much is the least amount we can alter it where we get a different category on the other side of your language model, right? So pin and pan are clearly different. Pin and pen, well, those are the same. I can't tell the difference between them, right? But it's just a little bit of difference, right? A little bit of placement of where your tongue is, a little bit of difference in the waveform, right? But it's still different or it's not, depending on your language and your vowel space, depending on your model, right? So we can also do this with notes, right? And that's what Van Aken did. So I'm going to be expanding upon some of the work that Van Aken put out, looking at patient descriptors, right? So they were very interested in how patient descriptors affected model predictions. And here, just to again very, very much formalize it, they had this test set and they came up with the hypothesis that they were interested in evaluating whether their models were invariant to patient descriptors. Was there bias in patient descriptors, right? Linguistic bias in those patient descriptors that were altering the model output. So they took a note and they systematically and minimally altered the descriptors in a consistent way and created parallel test corpora, right? So you're controlling all the clinical details for your prediction. It's just that one little thing that you think is different, right? Now, we'd expect these kind of more noise-based changes to be things like replacing all the periods with question marks or capitalizing random words, right? Those would be the noisy ones that all models will hopefully be invariant to. But here they had a hypothesis that there was something clear happening in the descriptor, and that's what they wanted to test and evaluate, right? So that's where we're going with behavioral testing, and that's the sort of question it lets you ask. Ribeiro et al. Also had this really good framing of, well, let's not just worry about it for single cases, right? So behavioral testing is also something you can do to create a whole suite of, a checklist for all of your models that you should always run. In their case, they were using a sentiment analysis model as their example, but you can apply it to any sort of NLP that you do, and you can even apply it outside of NLP. And we can talk about that, brainstorm that at the end if folks want to. So within the sentiment model, right, you can take this notion of, all right, I've got a social media post about an airline, and I want to say, is this post good or bad, right? Does this reflect positively or negatively about the airline? Well, my hypothesis is the content should matter, but not the city that we're talking about, right? I can take any city names and replace them with any other city name, and the model should give us the exact same answer because that doesn't matter as far as sentiment is concerned. And so you can set up those tests, automatically replace all city names with other city names, and hopefully don't see a difference. You can also think about these tests in other ways, right? You can frame them around triggering vocabulary, specific things like negation, right? So you would hope to see variance when you compare a note that says patient has history of diabetes to no history of diabetes, right? You can inject negation, no's, and nots throughout the note, and hopefully you'll see a difference, right? Hopefully you'll see things flip or change. You can also talk about invariance across forms or syntactic frames. So things like a history of diabetes versus a diabetic patient. Is your model doing an okay job of these equally valid, equally semantically equivalent representations of talking about patients? So that's another thing to think about when you're doing behavioral testing, right? Just general frameworks of behavioral testing to evaluate the robustness or fragility of your model itself in the face of language variants and accidents and typos and all of those things. Um, Now, just to formalize, I talked already a little bit about Van Aken. I can unpack this a little bit more because we're going to go into it in the valence language section. Um, but what Van Aken were trying to do specifically was looking at patient demographic descriptors, like I said, right? So what they wanted to test was when you have a note and you predict the mortality, what's the mortality risk for this patient given this note? What are the diagnoses for this patient given this note? And if instead of talking about a 58-year-old man, you talk about a 58-year-old woman, how much do those mortality risk predictions or diagnoses change? Right? If it's not a 58-year-old man, it's an 86-year-old man. How much do those risks change? How much do those diagnoses change? Right? Now, there are reasonable clinical reasons why we would say going from 58 to 86, there's maybe a higher mortality risk. Um, but if clinically everything's the same, what diagnosis differences would we expect to see for a 58-year-old man versus an 86-year-old man, right? Those are the things to think about. It's not always going to be a yes or no. Invariance is bad. It's a what is our expected invariance? What does our hypothesis say our acceptable variance for the model is or is not, right? Okay, that's how we're building these tests. That's how we're integrating it into our tooling and the types of hypotheses we think about and want to question. So let's talk about de-identification systems. And just as full disclosure, right, I was building this framework, this evaluation system, based on my experience as a linguist and minimal pairs before I knew about behavioral testing as a framework and a way to talk about this way to probe systems. But it was still an important thing, and it lines up exactly with how we're now using behavioral testing. I'm now using behavioral testing to talk about it. So what is de-identification? Well, when we have personally identifiable information in a note, things like names and phone numbers, and that PII is associated with health data, that turns it into protected health information. And we definitely should not release protected health information, right? So releasing PHI is a big problem. It costs our organizations a lot of money if we do it, and it introduces a lot of risk and harm to our patient and our patient population, right? So you have something like Call Me Ishmael, that's the PII, and my blood pressure is too high, that's the health information, and that whole thing is PHI, right? Now, one way to prevent releasing PHI but still allowing access to data is to remove the PII, right? So you can reduce that risk of PHI, of revealing PHI, by just getting rid of any evidence of PII, right? So it's just about, someone's name, right? There's some person and they have high blood pressure, right? But it's not an individual anymore. There are a bunch of categories about for PII that we have to worry about. I'm only going to be focusing on a couple in these talks, specifically names and addresses and dates. But there are more, right? And you can build this out to the other categories as well if you want to. Um, so, why do we even care about this sort of systematic bias, this sort of linguistic bias, this sort of algorithmic bias, and evaluating our systems for the bias in the domain of de-identification? Well, de-identification is kind of a special domain in the sense, like I talked about at the beginning, framing that question, the thing we're trying to identify is actually the anchor of a lot of group identity, right? When you're trying to identify names in the de-identification task, that very thing is the defining characteristic for a lot of folks of historically marginalized group identity. It both bears that weight, and people also, when seeing names, associate it with a lot of group identity, right? So we have that really strong anchor. But where this is especially fun, in my opinion, is all of the things you're trying to find are not so strongly anchored, right? You have things like address and dates and phone numbers, right? Those sorts of categories are equally important to identify, but should be untethered to any sort of patient identity, right? So when you're talking about bias, there shouldn't be any date related bias, right? It's bad at February dates versus March dates. That's a super weird thing, right? That's kind of noise in the universe we don't have to worry about, right? But if it's bad at identifying Hispanic Latinx names and it's really good at identifying white names, well, that's a problem, right? And that's differential harm. And that's what we're trying to look for. And that's what we're trying to use behavioral testing to help us identify. Okay, so a little bit more about the de-identification task and also why it dovetails into behavioral testing as a framework really nicely. When you're working with de-identification, often you're trying to identify these names and then deal with them. And one of the ways to deal with them is just redact them, right? Remove them. Um, it's fine and it works. It gets rid of the PII, except for the PII you missed, right? Because the PII you missed is still there. And if it's you see a full name in an otherwise redacted document, you're like, oh, that was the OG name, right? Uh-oh, right? So the other solution, which buys you a little bit more leeway, is what's called resynthesis, right? So you take a name and you replace it with a different name that also looks in context totally valid. So if you do miss a name, it's okay. Because when there's a name in the document, you don't know if it was one of the resynthesized names or one of the original names, right? So you get a little bit more grace there. Um, but this is also the very nature of behavioral testing, right? We're taking our original corpus and we're resynthesizing, we're shifting it, we're intentionally adjusting it in a way to say, well, you trained it only on people named Ishmael. It's really great at that, but it doesn't recognize any other name. Okay, so here's another name. Can it do okay? Right? But here we can do it by types of names, right? So we can shift it and we can have hypotheses about types of names that it does better at. And we can see these natural joins, these natural categories that are relevant because they encode linguistic bias into the task itself, right? That's why we were talking about Mitchell and colleagues having to use different categories for their different tasks. Okay. Um, Very practically, we were using this tool called Brat Synthetic, put out by O'Leary and Osborne. It's a very nice tool for doing resynthesis. It lets you provide not just the frameworks, the templates of how you are replacing the names, but also lists of names to replace them with, right? So there we go. We have the particular types of names that we're going to replace. That we're going to replace, and that's how it allows us to skew the names to bias the corpora that we're the new parallel corpora that we're creating. Um, so we need to come up with some hypotheses to test around this. Um, uh, there are two types of hypotheses that we can talk about. There's what you can think of as the charted identity effect, where what you're worried about is how well your system works given the actual real identity of the patient, right? So you could create a null hypothesis along these lines that says de-identification algorithms will perform equally well regardless of the actual gender of the patient, right? However that's presented in the note, the de-identification is going to do an equally well job, right? That's one way to do it. But we're really going to lean into this linguistic bias, this linguistic effect of the language form as the bearer of the bias, as the bearer of the salience and the importance, with the second hypothesis, where here we're saying de-identification algorithms will perform equally well regardless of the race and or ethnicity most strongly associated with a name. So it doesn't actually matter what the patient's actual identity is. It matters what the presentation of that identity is. Statistically, for machine learning models, right, how salient names are associated with different groups and how good they are, how common they are in different regions of the US, stuff like that, right? So that's really what we're digging into, and that's what we're emphasizing here with this work. Again, just kind of basic science stuff. We were using the 2016 INGRID de-identification corpus. It's a standard one in the field. There were a lot of different PII categories. We're only looking at names, time, and address, where names are those holders of identity, cultural weight, and time and address should be random, right? Should be the noise of the universe. Doing behavioral testing, we're going to introduce a little bit of noise, a little bit of wobble, and that'll help us understand the strength of that wobble. All right, how does this work? Well, we take a name. right? And we want to bias that name. We want to create parallel corpora with intentionally biased names. Luckily, we also have census data, right? And that census data tells us how biased names are, right? According to US perception of individuals on the census, right? So certain names are predominantly associated with 71% white, like Smith. Other names like Garcia, 92% of the people uh, are associated as being Hispanic Latinx, or assigned the category Hispanic Latinx in the census. So that means we can create these parallel corpora by saying, okay, let's take a name and let's make one version of the corpus biased towards white, one biased towards Black African American, and one biased towards Hispanic Latinx. And those end up being our parallel test suites, right? The pin, pen, pan, right? Can we distinguish between those? Does our model treat those differently? And we tested 6 different de-identification systems to do this, to see how it did. For evaluation, we used an in-house evaluation tool. It's available on GitHub, called Etude. And it's handy because it lets you deal with if your corpora are in your data sets are in different formats. It normalizes them for the evaluation. And even if your annotation schema don't technically match up, you can create that mapping value between them in a very handy way. Um, Now, a lot of times when you're doing this work, you're worried about relative performance, right? It's not what is the F1. It's not what's the false negative rate. It's not the true positive rate. It's that parity, that relative performance, right? So how good is the false negative rate for group A versus group B? That's what you have to use when you're doing a naturalistic disaggregated performance, right? But because we're doing behavioral testing, we don't have to deal with parity values because what we're doing is we're evaluating corpus A versus otherwise identical corpus B, right? So everything else is held constant except for that one bit, the one bit you're trying to test. So we're going to skip over the parity value evaluation. We can go back to that later if folks want to talk about it more. And we're going to talk about the direct behavioral testing evaluation. All right, I'm going to unpack this figure for you. The difference between the top and the bottom is just the y-axis, right? So we scaled the y-axis on the very top row to be the full extent for that model, for that de-identification system. And the bottom row is everything is scaled on the same y scale, right? So you can see them relative to each other. Within a de-identification system, we have our 6 systems here. The first column there is the original 2016 test corpus, right? With a random smattering of name types, which we've also done as part of this analysis. We actually categorized those names and then did a separate evaluation there. But here I'm just talking about the skewed corpora, the shifted corpora that we're working with. So we took that original corpus and we used Brat Synthetic to replace all the names with Black African American biased names according to the census data. And we did that 5 times. So we get 5 random different sets of names across all of the different notes. And then we did that for ENUS, where ENUS is predominantly white names, and then Hispanic Latinx names, again, according to the census data, right? And we looked at that relative performance across systems. Now, there are a couple interesting trends that happen. One, you get the systems like CliniDID and NeuroNER, the 4th one down, right? Those are pretty close to ceiling at performance. And you see a little bit of a drop when we shift the names. But generally, it's pretty good, right? There's not a huge amount of variance for those systems themselves. The other kind of very surprising for us result that we found was looking at the NLM scrubber and the DID system, where you actually saw a boost in performance, right? And based on some early work, we're still working to verify this all the way. The reason why we saw this boost going from the original system improved performance when we resynthesized it was that our resynthesis wasn't sufficiently naturalistic, right? It wasn't as varied um, or as noisy an input as the original corpus, um, which allowed the systems to do better on average, right? The reason why you don't see the same thing for Clinia DID and Neuro NER is that they're already so good that they're above that noise threshold. But for NLM Scrubber and DID, we see that happen, right? And they both get hit by it, which is a really important lesson for anyone who's trying to do something like use large language models or Gen AI to generate fake data, right? You have to be really, really certain that your naturalistic forms are actually truly naturalistic, and you're not accidentally hedging in the noise of your data and making it too simple a task, right? And excluding a lot of actual true variants that you see in the world and losing that generalizability. Okay, let's switch over to valenced language use. First, let's unpack that term, valenced, right? So you have pejorative and laudative language, things like belligerent and pleasant. So these terms often show up in unstructured clinical notes created during the course of patient's treatment and care, right? A lot of people have found that, including my lab across a bunch of different hospital sites, a bunch of different corpora. So it's there. It's a fairly persistent and resilient finding. But it's not just the words are out there, right? That's fine. Words can be out there. The problem is that patients from historically marginalized gender, racial, and ethnic groups, and those who suffer from historically marginalized conditions like diabetes and substance use disorder have statistically significantly higher proportions of notes with stigmatizing terms in them compared to baseline rates, right? So it's not that the language is out there. It's the language is out there and very concentrated for certain types of individuals. Harigian and colleagues have done a kind of interesting study looking at how we identify those words in notes. And they've framed it as not a word identification task. So it's not about saying, aha, here's the word compliant. That is pejorative, right? It's a word sense disambiguation task. So you have to both find the word compliant and then identify if it's being used pejoratively, neutrally, or laudatively, right? So it's more than just word search, right? It's more complex than that. So there are consequences of this as well, of these words being out there, right? So negative term usage is reported to correlate with lower clinician adherence to national guidelines for care, lower patient care concordance, and lower trust in the healthcare system in general, right? Those are all bad things. And then also the patient's perception of bias correlates with delays in care, lower chronic screening rates, and fewer follow-up recommendations, right? All bad news. But it's worse. It's not just a couple bad apples that you got to throw out of med school, right? Because clinicians who read vignettes containing pejorative language make recommendations less compliant with clinical guidelines as compared to patients with no such terms and identical clinical characteristics. They took a vignette. Sometimes they added a pejorative term, sometimes not, right? That very simple, minimal change to see how the model differences. Here, the model is the clinician, right? The clinician's brain. And before you think too poorly of these clinicians, be careful because I used a pejorative word to describe them. This is about the process and that the process is problematic and something we have to be sensitive to. So how can we look at that? How can we evaluate that and see what are the effects of this, right? All of those effects that I talked about were on the human side, right? Between human-human interactions and human outcomes. I'm interested in the model and downside, right? So that's what I'm working on in my hypothesis space. And here what I'm saying is that the biased term use, these valence terms, impacts the semantic vector spaces we build with these data sets. And all of the derived word embedding models we train from these semantic vector spaces, right? This is the core infrastructure of large language models and generative AI again, right? So if this is poisoned, we have to be careful. We have to be worried about that. So that's what I'm trying to probe with behavioral testing. How can we do this? Well, let's do document level phenotyping, right? Or diagnosis code prediction. So we can take this, we can take a note, a 58-year-old woman with a history of hypertension. blah, 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 blah. And there's no mention of any valenced words here. And we try to predict the diagnosis, right? Or the diagnosis codes, I guess. And then we create parallel corpora where we take that same note and we add in one set laudative terms, in another set neutral terms, and in a third set of notes pejorative terms. And we look at what the difference in diagnosis code predictions are, right? How does this one word in the entire note alter the entire note's prediction? This is all based on Mimic 3 and building out Van Aken's infrastructure, right? We extended that a whole lot to allow for valence vocabulary to be tested in this way. But that's what it's built on. And I'm talking about this. So of course I found a result. Kind of very specifically, what we found statistically significantly different, right? Very coarse grained analysis so far, right? We found a one-way ANOVA test between valence types indicated that there was a statistical significant difference in average probabilities across all diagnoses combined. And then also a two-key HSD multiple comparison of means of probabilities across all diagnoses found that the probabilities generated for the pejorative corpus was statistically significantly lower than for those generated for the no mention corpus, right? So you add those pejorative terms in there and you're suppressing diagnosis code predictions, right? That's what's going on. And that's at the gross level, right? So why is this cool? Well, what's the general takeaway is that, well, behavioral testing allows us to do these very controlled language experiments where we can just change one word and look for how much impact there is on the model and test these very specific, in very controlled ways, hypotheses, right? Some general takeaways. What we see happening in de-identification, there are a bunch of ones, but the really one to lock in on is this naturalness of synthetic data is very, very important and can give you a false sense of understanding of what's going on. There's some other kind of intersectional analyses and additional analyses we need to do, especially with lower frequency words or equibiased words to look at there. We can talk a little bit about how we tried to make this resynthesis process as representative of the original corpus as possible, matching all the different frames as much as we could. But apparently it still wasn't naturalistic enough. So we got to dig into that some more. And just for, again, disclosure, Xiao et al. Did a similar study at the same time as us looking at snippets, right? So they just had kind of sentence level, sentence size things rather than using the whole note for the de-identification task. Now, the thinking about valenced vocabulary, right? Valence language usage in general. When we were trying to use behavioral testing for this, Van Aken was able to use these patient descriptors that are very well behaved. That is to say, wherever you can add a patient demographic descriptor, you can probably add a different descriptor, right? It's very easy to shift your corpus by swapping in situ, swapping in place all the different descriptors, right? Valence language varies a lot more, right? So some of the valenced terms you can use in the same place as other valence terms. And some of it just doesn't make any sense in other syntactic structures, right? So one of the things we're working on is a lot more robust, varied, contextually sensitive shifting, right? So that we can look at the impact in a lot more interesting environments to see what's going on. Like I said, we're looking at, I've got a grad student working with me right now, Frederick Giassi, doing some cool work on word specific and type specific stuff. And he's got some cool results, but I don't want to spoil his fun by telling you too much about that. And then there's some limitations being this whole valence language work being very lexically focused and a bunch of other analyses that would be cool to look into. And making them more fine-grained, which Frederick is helping me do right now. So that's great. So that's the talk. Thanks for coming. You can see a bunch of our code is shared on Codeberg. Some of the older stuff is on GitHub. O'Leary's Brat Synthetic and Van Aken's clinical behavioral testing tools are also on GitHub. And this work was partially supported by Picori, so thanks for the money, Picori. And email me after this if you have more questions, or you can find me on Mastodon. Um, so yeah, thanks.
That was great. Thanks very much, Paul. This is really, really an interesting talk, and I think we've got one question in the Q&A and a lively discussion in chat. If it's all
Yeah.
right, I hope I can maybe get the first question in, if that's okay. Um, well, so Paul, I'm kind of curious. I think a lot of academic medical centers and others are working to like de-identify um, their clinical notes for research purposes and things like that. And I'm wondering, just kind of a naive question, is the use of, for example, you had filter, which I think came from UCSF,
Yeah.
as one of the systems you evaluated, and it's a non-neural based approach, right? It's just a kind of a bucket of regular expressions going off of the phone book, so to speak. Um, is is that because that's a rule-based approach, do you see that as something that could potentially be less problematic, or is that or is there a more nuanced kind of way to think
Uh,
about
Differently problematic. So you have so rule-based systems, well, they aren't going to generalize very well outside of very specific domains and very specific data sets, right? So who's not getting polled in the corpus, right? Or in the census data, right? You're pulling these name lists from census data, from phone books. So you have to ask who's not answering that question. You also have to ask which populations are using traditional names versus which populations are using more innovative naming techniques. And that population socioculturally has changed over time, right? So that ends up being another very obvious natural joint in your data set of for names that weren't previously in the census. How good are we at identifying those types of names, right? So we did a test like this right when Game of Thrones was becoming popular, and Khaleesi and all these variants of Game of Thrones characters names were showing up in birth records, right? But they weren't in any prior lists, right? So suddenly you have, oh man, all of those people are gonna not get correctly identified by de-identification systems, right? So huge problem there, and you can address it with other things, and that's where context is kind of nice, because this is where we tend to say a person's name, and that's where the non rule-based dictionary-based lookup systems are handy. So
that? Makes sense. I was discounting the Khaleesi's of the world, which
ooh, that's a good way to get killed. I would not do that.
So, well, next question. So this is from Dr. George Kim, and George asks, what is or are the sizes of the clinical record corpora you're using? So just in terms of number of patients, types of records, things like that.
Yeah, so the data sets that we worked on for the valence language was 3 to 4,000 notes. I don't remember exactly what the test set was within Mimic. But it's a lot. I mean, right, it's 3 to 4,000 notes, but you're also comparing, you don't have to, with behavioral testing, you don't have to split that by group, because we had, we'll say 3,500 notes for group A, the same 3,500 for group B, the same 3,500 for group C. So you don't have that imbalanced data set issue, and you don't have to split it and worry about really small groups there, right? You can artificially boost how big each intersectional group is. So that's kind of neat. For the de-identification, I don't remember off the top of my head how big the 2016 test corpus is, but I think I got my cheat sheet right here for um oh nope, that's not the cheat sheet. Oh well. So yeah, I don't remember exactly how big it is, but it's hundreds to thousands. for the 2016 test, but we did it on 2014 as well. Um, and that's another big data set for de-identification. It's what most of these de-identification evaluations are based on. So it's a fairly standard size, and the expected performance gap, the power analysis, pretty similar across evaluations. So hopefully the GChem, that answers your question there.
All right, and this is George's next question. What work has there been in valences in text for the detection of something like depression or suicidality? There was some work done by John Pestian, not sure if I'm pronouncing that right, at Cincinnati Children's.
I honestly don't know. So there are a couple ways to think about this. Um, and this goes into I'm basing this off of my understanding of pain, right? And pain evaluation, right? So if what you're interested in doing is, can we identify depression or suicidality in a patient? Um, and what are the linguistic biases, the squirrel terms, right? That's a phenotype level, document level, patient level task. So I'm thinking about it in terms of squirrel, right? So I'm just kind of unpacking this live. So what are the squirrel terms that are going to happen there? What we know about pain discussion and pain management is that if the same level of pain is presented to a clinician for different types of patients, male versus female patients, white versus African American, and African American female patients, right? You see a huge intersectional impact on how the clinician then records what that means, right? So the same value, the same presentation of here are my symptoms ends up with different results going through the model that we consider the clinician's brain, right? So I'd imagine there would be similar sort of impacts of depression and suicidality, right? So if you talk about feeling down, um, uh, or you talk about having issues with anger management, if I'm stereotyping you as a certain type of person that I have cultural reasons to assume tends to be a more angry type of person, that's going to affect my model output on the other side. So how often do you see things like depression and anger being associated with the sorts of things that certain classes of patients talk about or don't talk about? So you'd have to look at how often do those triggering words, those squirrel words show up. And this is where you can kind of tie it into something neat like Lyme or Shapley to look at which words are most overrepresented in different groups and how much do those words impact the model performance. And do they differentially impact the model performance for different groups, or is it just that they tend to be more often documented for certain types of patients? And that's how it would bias your model in those ways, right? So again, this is the sort of thing I'm looking at the model, like how are the models we train and the models we used impacted by these biased, statistically skewed data sets. And there are a lot of other folks working at the level of going from society to clinician training to patient description to clinician note taking, right? And that's another huge set of the work. And I'm just not skilled. I don't have the right tools to ask those types of questions, right? So it sounds like you'd also need to be looking at those questions. But I'll look up, I don't know John Pestian's work. I'll look it up to uh, see what's going on there, because that'd be neat. We've done some stuff with suicidality. Um, uh, so we could maybe integrate that in the analysis too and see if it all comes together. So yeah. All right. I'm going to flag that as answered live.
Right. Well, if I don't see any other open questions at the moment. Well, wait, I take that back. So Dr. Matt Robinson just asked in the chat, do any of these approaches work to de-identify contextual IDs, such as the senator from Arizona?
So occupation is technically PII. The problem is that it is almost never talked about in notes. So actually doing a good job of training models to identify it well is very hard to do. It's very hard to evaluate how good you're doing. So something like unique names like the senator from Arizona, which narrows it down to a very small handful of people, um, uh, is tough, right? It's tough to see how good you do. So most systems that I know don't really deal with that. What they would do, just knowing how they work, is that it would be the senator from Arizona's a state. So I'm going to replace it with a random state, or a location, I'm going to replace it with a random location. So it may, turn into the senator from Missoula, right? So it may be not just a different location, but a different category of location, right? That may be one way that it gets essentially resynthesized. As far as those unique phrases, um, no one's really looking at that. There's a lot of inference stuff that goes into this that would make it very easy to as well infer what's going on and infer. That is all within the scope of re-identification research, um, which is outside of my knowledge space, right? That's a lot more into the security issue side of it, and I honestly don't know enough about that.
All right. Well, we're getting very low on time. I do have one last question that maybe we'll have to cut short, and well, maybe it'll be a future conversation, Paul. But so just real quick, we had a kind of really great session in our Grand Round seminar where our students and faculty members kind of come together and talk about topics around these monthly talks. And we were
Mhm.
thinking about language models, and one thing I pointed out is with very, very large models, they tend to learn meta concepts, right? So if we train on a huge, huge corpus like a subset of the internet, at a certain point, the models appear to not only learn, there's lots of biased information on the internet, of course, but
Yeah.
the models themselves appear to, in a meta fashion, learn to detect their own biases, so to speak. This is kind of hard to measure at scale, but I'm wondering, do are language models maybe a potential way to alleviate some of these potential inherent biases, or is that kind of a flawed assumption and not how you think about it?
I don't think about it that way because you run into the issue at, at the very theoretical level. You run into the Erdős problem of enumerate all the biases that aren't already on your bias list, right? And the computer's not going to be able to do that, right? For solvable issues. Um, you also have a lot of issue with them very much being overtrained on the types of biases that they're sensitive to. So you can see a lot of classic examples where, there's that one about um, uh, someone's in a car accident and their parent is the surgeon, and you have to figure out, the trick of figuring out this thing is that the surgeon is a female, and that's how they're their parent. And oh no, it's a gotcha, right? You've unpacked some gender biases there. Um, and if you change it so that the surgeon is the father and not the mother, it still says the surgeon's the mom, and you're like, oh no, you just memorized that. Oh, okay. You've just memorized this paradigm of logic problems, and you always give the wrong answer that's based on the funny or, so you end up with large language models that often reify it that way, right? And then in the next release of the model, they patch that problem. So you just go to the next, philosophy of language example in the next philosophy of language paper, and then they patch that one, right? So there's an arms race there. I don't think it's very good or very useful thing. I think it's a lot better to sit down and talk with the stakeholders and be like, where do these biases come from? Like Stuart Ray mentioned, I wasn't able to read it, but this difference between compliance and adherence, and how within that scope of how it's considered okay or not okay or paternalistic to use compliance versus adherence. You really have to talk to the stakeholders to brainstorm those.
Yeah. That makes a ton of sense. Well, this has been really great. Thanks very much, Paul, and thank you for everyone joining. And we look forward to seeing you next month as well.